Bismillahirrahmanirrahim. Assalamu alaikum. This is Berza. I'm from BS Biotechnology. My roll number is 22013231002. My course is PC1. So my topic is shockwave therapy. Today topic. So let's start. First of all, overview of the shockwave therapy. Introduction, history, development, physics of shockwave therapy, types of shockwave therapy, mechanisms of actions, clinical application, safety, and effectiveness, future direction, and book references. Now, let's move to the introduction. What is shockwave therapy? Shockwave therapy is a non-invasive treatment that involves creating series of low-energy acoustic wave pulsation. These waves are directly applied to an injury through a person's skin via gel medium. Extracorporeal corporeal is outside body that is used shockwave. Well-controlled mechanical installed to tissue. Fast pain relief and restore mobility. Now, let's move to the history. In 1980s, shockwave therapy is introduced. In 1983, the first commercial lithotripper. Lithotripper is basically the breakdown of kidney stones that is introduced by the donor lithotripper. In 1985, other organs such as the gallbladder, bile duct, pancreas, and salivary glands have been treated with shockwave. Last 2 decades, it has been used as a method for musculoskeletal disorders and stimulation of bone growth. Now, let's move to the development of shockwave. Development of shockwave therapy. The development of shockwave therapy device is closely linked to that of the electric extracorporeal shockwave lens. First one is the electrohydraulic devices, which use the tips of an electrode as a point source. An electrical spark is generated between tips and release a shockwave. These phenomena are associated with the vaporization of the water between the tips. Second one is the piezoelectric. Piezoelectric crystals are mounted in the spherical surface generators. The external energy supplies this system and force piezoelectric crystals to contract, generate electric shockwaves. Shockwave therapies. Now, third third device is electromagnetic wires. Using an electromagnetic wires and a metal membranes placed opposite to the release the shock waves. All these devices produce focusing pressure pulses. These three devices are shown in the figure. First one is an electrohydraulic, second one is a piezoelectric, and third one is an electromagnetic flat and electromagnetic cylinder, and last one is the radial. Now let's move to the next slide. Shockwave theory. Extracorporeal shock waves or pressure waves generate acoustic. Shock waves are different from other acoustic waves because they are at a low frequency. There are many examples of these sonic pulses waves in real life. A more day-to-day billion of shock waves are those created by clapping. Aeroplane breaking the sound barriers which generate an audible bang and can lead to the breakage of glass even in distinct area. Now let's move to the shock wave works, how it is work and why it is work. Why? First one is how it is work. Shock wave trigger a metabolic reactions when delivered to tissue. First, relieve pain during treatment and helps soft tissue heal in 6 weeks after treatment. Why it is used in the shockwave as a work? Because it is fast and effective, it is clinical approvals, no medications, and non-invasive. Next is the physics of shock waves. Physics of shock wave. Shock wave can be considered to be one kind of stress wave. A shock wave carries energy and can propagate through a medium. A shock wave has the following characteristics. Number one, it has an almost vertical front. The material jumps from the non-shock to the shock state instantaneously. This is across the shock. There is always an extremely rapid rise in pressure, temperature, and density of the shock medium. Second one, it occurs when a material is stressed far beyond its electric, electrostic limit. Its velocity increase with increased pressure of stress. There is an entropy increase when a shock wave is formed. Now, types of shock waves. There are two types of shock waves. First one is a focused shock wave. Second one is the radial shock wave. A single pulse with a wide frequency range from approximately 150 kilohertz up to the 100 kilohertz. Focused shock wave and radial shock waves. Focused shock wave. High pressure amplitude up to 150 megapascal, low density waves up to minus 25 megapascals. Small pulse width and a short rise time of up to a few nanosecond. The focus shock wave that show in a figure that you can see in this on the screen. Next, move to the radial shock wave. Ordinary sound wave with a pressure of up to 3 megapascal and much higher rise time of about 3 microseconds. Radial shock waves. Extracorporeal shock wave therapy are generated in two main ways. Number one is a pneumatically. Number two is the alternating magnetic field driving a projectile down a tube located inside the handpiece. Radial shock wave, how can it work? That show in a figure. You can see this figure. Next, mechanism of actions. Let's start. Reaction phases of extracorporeal shockwave therapy on tissue are four. There are physical, physiochemical, chemical, and biological. First one is the physical phase. Shockwave cause a positive pressure to generate absorption, reflection, and transmission of energy to tissue and cell that appear that cavation increase the permeability of cell membrane and ionization of biological molecules. Number two is the physiochemical. The physical stimulus lead to a biochemical reaction. Extracorporeal shock wave therapy triggered the release of biomolecules such as adenosine triphosphate, ATP, for the activation of cell signaling path. Third one is chemical phase. It has shock wave alternating the function of ions, chemicals, channels in cell membrane, and mobilization of calcium. Number four is biological phase. Extracorporeal shock wave therapy play its role in modulating angiogenesis, anti-inflammatory effects, and healing of bone and soft tissue wounds. Now let's move to the mechanical promote healing way through pain relief. Extracorporeal shock wave therapy is a non-invasion treatment that involves delivery of shock waves to injured soft tissue to reduce pain and promote healing. It also decreases your pain by directly stimulating your nerves at the site of injury. Tissue regenerating. The hypothesis of extracorporeal shock wave therapy leading to tissue regeneration seem possible and does match with the principles of mechanotransduction. Mechanical load applied on the cytoskeleton stimulates cellular response and an increase in protein biosynthesis. Last one is a blood flow and inflammations. The shockwave create an increase in inflammation and blood flow to the trigger area and can break down fibrous scar tissue which build up over time, especially with chronic condition. This helps to stimulate cell regeneration and promote tissue healing, resulting in improved pain and function. Now, let's move to the clinical applications. Number one, tendinopathy. Tendinopathy is basically the clinical application. So let's start tendinopathy. What is tendinopathy and how it is clinical applications of shockwave therapy? Several studies have reported favorable results of shockwave therapy in athletes with jumpers knees, patellar tendinopathies, with the success rate range from 73.5% to 87.5%. Extracorporeal shock waves therapy was also utilized in patients with patellar tendinopathy, secondary to or west of the patellar tendon for ACL reconstructions. Many studies investigate the effect of extracorporeal shock wave therapy in Achilles tendinopathy and most reported favorable results with similar success rate as patellar tendinopathy. Tendinopathy is basically in the is a disease that are present on the bones, for example, which located on the uh, knees and shoulders. The figure that show the tendinopathy. First of all, the figure that show the shoulder of a person that is caused of rotating coughing pain because of tendinopathy and tendons tear and tendinopathies. Symptoms is feeling pain when you move arms in certain ways or, or lie on it. Next is a proximal plantar fasciitis. Let's start. Many studies investigated the effect of shockwave therapy in treatment of proximal plantar fasciitis and report a success rate ranging from 34% to 88%. Majority of the published paper reported a positive and beneficial effect of extracorporeal shockwave therapy in proximal plantar fasciitis. Application of extracorporeal shock wave in proximal plantar fasciitis is performed with either local anesthesia or no anesthesia. Several reports shows that extracorporeal shock wave therapy is less effective when the treatment is formed with the use of local anesthesia. This figure showed the plantar fasciitis, that is on the heel bone, that is the calcaneus, and the heel suffer inflammation under the feet that cause a plantar fasciitis. That is clinical application of shockwave that helps to improve your heel pain and inflammation. Let's continue. The complication of extracorporeal shock wave in a proximal plantar fasciitis are low and negligible. Local reddening, ecchymosis, and mild hematoma and migraine are among us the list of complications. In summary, the literary review unveils discrepancy and controversy on the effect of extracorporeal shock wave therapy on proximal plantar fasciitis. Many factors can influence the effect of extracorporeal shock wave therapy in the treatment of proximal plantar fasciitis. The vast majority of published papers are in favor of extracorporeal shock wave therapy. Let's move to the last clinical application. So many are present, but this one is the last on screen. Osteoarthritis. Osteoarthritis, it is The most common form of arthritis, some people call it degenerative joint disease or wear and tear arthritis. It occurs most frequently in the hand, hips, and knees. With osteoarthritis, the cartilage within a joint begins to break down and underlying bone begins to change. Extracorporeal shockwave therapy has beneficial effect on cartilage, subchondral bone, and surrounding tissue, can provide relief from chronic pain. The figure that can show the osteoarthritis. First one is a normal knee joint that present a cartilage is a normal. No is a destroying the cartilage. When the osteoarthritis disease that is basically caused on the joints and degenerates the joints that degenerate the cartilage and to form a osteoarthritis. Second one show the osteoarthritis in a figure. You can see this. Let's move to the safety and effectiveness. First, safety. How it is safe. Why it is safe. Shockwave therapy. Although shockwave therapy is extremely safe for the vast majority of patients, shockwave therapy has excellent cost effectiveness of ratio, non-invasive solution for chronic pain in knee, shoulders, back, and heel, etc. No anesthesia required, no drugs. Limited side effects. New research show that it can be positive effect on acute pain. Many field of application, orthopedic, sports medicine, and so on, etc. Now let's move to the contradiction. Contradiction basically which the body parts that affect by the shockwave therapy is the below in this point. You can see it. Eyes, major blood vessels, cancer, pregnancy, clotting disorders, open wounds, major nerves, brain. Now let's move to the side effects. Side effects from extracorporeal shockwave therapy are limited. Side effects usually come and go within 2 to 5 days. Discomfort or pain during therapy treatment, red skin, swelling, numbness, increased sensitivity, nerve pain. Increased sensitivity is hyperesthesia, and nerve pain is basically the neuralgia. Now move to the how successful is shockwave therapy. There are 2 points. Number one is a shockwave is most widely researched rehabilitation modality used in physiotherapy clinic with increased number of scientific studies at each year. The majority of research validates the effectiveness of extracorporeal shockwaves and show successfully treatment rates of up to 90%. Now let's move to the last point, that is the conclusion and references. Conclusion. We find the conclusion of shockwave therapy. What is the result? So let's start. With the general increase of research on extracorporeal shockwave therapy, it demonstrates the application of extracorporeal shockwave therapy is more and more extensive or comprehensive, such in musculoskeletal disease, bone delay union, neurological injury, embryology disorders, lymphedema, and so on. In addition, the mechanism is not destructive damage as initially thought, but a restorative treatment. We use bibliometric. Bibliometric is basically the publishing or publishing of books or articles which include many topics. That one is extracorporeal shockwave therapy. To summarize the knowledge related to extracorporeal shockwaves, there are six host hotspots are the focus of our research. Among them, the research on extracorporeal shockwave therapy in spasticity and osteoarthritis is relatively mature, while the research in promoting angiogenesis is less mature. Delay adenine, cellulite, cellulite, burn, and diabetic foot ulcer are also popular in shockwave research and may navigate the future direction of scientific studies. Now let's move to these recently researches. Very recently, animal model studies have increasingly demonstrated the efficiency of extracorporeal shockwave therapy for osteoarthritis. However, few studies have explored the clinical application of shockwave therapy, probably due to lack of mechanistic clarity and scientific evidence. Last one is the osteoarthritis is characterized by main feature articular cartilage degenerate and some chondral bones remodeling and cardinal symptoms of pain and restricted motion in the affected joint. Several studies have proven that extracorporeal shockwave therapy may be anti-inflammatory, angiogenic, anti-edema, and trophic effect in the modification of cartilage and subchondral bones. The most feature pathological change site in osteoarthritis. There are many recent researches, but few of them is here. Last research evidence on the research of calcific tendinopathy. Now start high energy extracorporeal shockwave therapy for treating chronic calcific tendinitis of shoulder and sympathetic review. Result high energy extracorporeal shockwave therapy was effective for treating calcific tendinitis, reduce pain, improve function, resorption of calcifications. Low energy extracorporeal shock wave therapy is less effective. Regardless of energy level, extracorporeal shock wave therapy is not effective in treating non-calcific tendency. That is research that was on 2014. And last one is that shown the screen is a clinical orthopoma that research on 2020 my lemon supply 3 and published online 2020 Feb 12 Feb that show in the link. Now, some of the references or links that show the shockwave therapy, how, what, when, history, introduction, and so much material give it, you can give it, and can you understand it? This is from my side. This is from my side. Thank you so much.